Hi, Dr. David here, and I want to tell you about my new book briefly, Sex Under the Influence. It's just out. It's available on Amazon as an ebook or in print right now, and it's really the ultimate guide to understanding sexualized drug use, or what we call chemsex, among men who have sex with men. It has a lot of research, has a lot of skills, has a lot of tools, so do look for it. But in that regard, I want to answer a question today from a viewer, and that is, what is the difference between hypersexuality and sex addiction, or is there a difference? So what is hypersexuality, first of all? Hypersexuality is just being very interested, consumed with, engaged in sexual activity in a manner that's more than normal, whatever normal is. And so that can be the result of all kinds of things, and not necessarily sex addiction. So what could be a result of? Bipolar disorder. So when people are in a manic phase of bipolar disorder or any other syndrome that can cause mania, one of the ways that mania can be expressed is in engaging in a lot of sexual activity. So people may get very promiscuous in a manic phase. That's not sex addiction. It's being driven really by a chemical difference or imbalance in their bodies that are driving them into that mood state. Another way we see what could be considered hypersexuality is in obsessive compulsive disorder, where people are really engaging in sexual behavior sometimes as part of their little ritual, not just because they're interested in sex so much as to relieve the anxiety that's dwelling up in them. Sometimes in their particular formula for relieving themselves of the OCD symptoms, sex can be a way of expressing that, but it's not related to sex addiction. Sex addiction is really also, it looks the same. It may look the same, right? A lot of promiscuity, a lot of engaging sexual behavior, but it's really a compulsive behavior that is truly an addiction. And what does that mean? Addiction has several different specific criteria, and we look at these. There's 11 of them actually in the DSM. The three that are most important, I think, are kind of a shorthand. One is to be obsessed with this behavior, to be preoccupied. Just can't, when you're not acting out, you kind of can't get you can't get the thoughts out of your head. It's really got a grip on people in a big way. Another one would be that people lose control. So I say, I am never going to do that. I draw a line in the sand, and then if I'm an addict, I do that. And then I have to draw another line in the sand. And that's this process of continually saying, I will never do that, and then we do it. And it's an irreversible one-way street of downward progression that is really caused by the addictive disorders. So we have that loss of control. And finally, probably the biggest hallmark of addiction is continuing to do what you're doing, whether it's drug use or behaviors, despite adverse consequences. Maybe I lose my job, maybe I lose my relationship, maybe I lose all kinds of things, but I keep going. So that's the difference between hypersexuality and sex addiction. Dr. David here, signing out. Talk soon.